insights gained through the Access to Medicines Index really serve as a bit of a North Star in terms of best practice and what could be done to expand our work in access to medicines and in global health equity. So, for example, the session that I'm at today, which is an Amsterdam session on expanding worldwide access to diabetes care by 2030, this is a perfect example of a platform where all kinds of different partners from different sectors can come together and talk about what's working, but also the gaps that need to be filled and how could different partnerships or ideas be developed to do that. We're also very much encouraged by the Access to Medicines Foundation's increasing focus on non-communicable diseases, and knowing how much of the burden is driven by diabetes, but also obesity, cardiovascular disease, etc. It's encouraging to see that there's a amount of rigor and amount of interest in expanding that area. We're also very happy to see movement into evaluating going beyond innovative pharma and looking at generic companies, looking also at device manufacturers, because that really recognizes the fact that a person living with diabetes or another condition, the way that they access their care isn't just about one product. There are a number of different actors, product services that need to come together. So for us, that's really important, and we're grateful for that holistic lens. In everything we do, it's important that we have people living with diabetes at the core, and it's important that when we measure our success, it's by whether or not we've reached them and with a good quality of care and service. So within our different programs, we look at making sure that insulin is accessible. So for example, we've reached globally 40 million people with diabetes in 2023. Part of that is definitely in low and middle income countries, and that's where programs like our Access to Insulin commitment, which guarantees a low ceiling price for insulin, applies. We've also reached over 50,000 children in our Changing Diabetes for Children partnership program, and we hope to scale that to 100,000 by 2030, along with our partners. Within our eye care model, and that's a business model that we use in Africa that aims to integrate access into the business itself, so not standalone but integrated. And in there's different tracks and pillars, but we've reached many thousand healthcare providers with training, many thousand people living with diabetes with education materials, and also through then the Access to Insulin commitment reached people living with diabetes who can actually access their insulin.